Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we have Amaka Nnamani. She's a pediatrician, and today's Kevin MD article is It's Time to Pass Federally Mandated Paid Parental Leave. Amaka, welcome to the show.
Thank you. That's an honor to be here. Thanks, Kevin.
So, you are a pediatrician. Tell us a little bit about your story and journey.
Fantastic. Yes, I am a pediatrician, the best job in the universe. Don't argue with that. My journey has been quite interesting. I trained as a pediatrician, been a pediatrician for over 10 years now. But a few years ago, actually a couple years, about 3 years ago, I made a very difficult decision to leave full-time clinical outpatient care. And to be quite honest, at the time, I didn't have a plan.
Mhm.
Did not quite have a plan. I just knew I needed a break. We just had our third child in the midst of the pandemic. He was born 4th of July, 2020. There's not a better time to be born, I
Yeah.
guess. And there was a lot going on in our personal lives, but I just had to make that decision. And in my time away, I decided to explore other non-clinical aspects of my life. And for me, that included writing. I've always enjoyed writing. And so it's always been an outlet for me, more therapeutic than anything. And so I decided to take a few writing classes. And I just woke up one day and said I was going to write a picture book on breastfeeding. Well, that journey lasted several months, and I ended up self-publishing a picture book titled Zara's Quest, Mommy's Milk Rocks. And that has actually opened up a whole new path for me into public health advocacy and a lot of other exciting things. So that's kind of my background. Still a pediatrician, always will be. I just do more contract and slash locums type things, but continue to feed other interests that include public speaking, education, advocacy, and all that fun stuff.
Oh, I love that story so much because I talk to a lot of doctors whose identity is just being a doctor. And then you said that you paused clinical medicine a bit. You didn't have a plan, but then
Hmm.
eventually this opened up a whole new world, publishing, speaking, that you initially didn't have a plan for. And now that's
Yeah.
your professional life and identity.
Yes. You couldn't have said that any better, Kevin. You're spot on. It quite serendipitous, I would say, but I'm glad for it. Really grateful.
So one of your articles is on Kevin MD. It's titled "It's Time to Pass Federally Mandated Paid Parental Leave." For those of you who
Hmm.
get a chance to read your article, tell us what led up to it and what it's about.
Absolutely. So my personal experiences led to that. So I'm a breastfeeding advocate, and so that just means that with that, I don't just advocate for mothers to, for birthing people to breastfeed, but also to have laws and legislations that support that choice, right? Because it's one thing to say, I'm a mom, I want to give my child the best nutrition I possibly can. It's one thing to make that decision, but it's a whole different thing to have the support system around you. And so that was kind of detailing my personal experiences. So for those of us that haven't read the article, I was one of those crazy people. I started residency pregnant. I was the intern who showed up pregnant, 4 months pregnant to be
Mhm.
exact. At the time that I'd interviewed, I was not pregnant. So I would say it was a bit of I wouldn't say a shock. It was definitely a blessing, but it wasn't something that the residency program had been aware of, right, prior to me just starting. And so I remember being told by an attending, basically, who made it quite clear that that was not a good decision, especially because my husband lived in Nigeria at the time. So he was
Mhm.
thousands of miles away. So I was a single married mom, if you will. But I had made that decision to exclusively breastfeed our daughter, primarily because I'd seen a really, really good friend of mine do it, and she was a single mom at the time, working in corporate America. And I saw her do it, and I said, if India can do it, I can do it. And she was so supportive. But what I didn't have was the support, the workplace support, right? Well, like I said, I showed up pregnant. Oh, I started residency pregnant. And so I already felt like I was the weak link, right? Especially because my husband wasn't there. So I felt like I needed to overcompensate for for just my condition, if you
Mhm.
will. And so I remember I hadn't qualified for FMLA because I hadn't worked a year. But I had a residency coordinator, Coretta. God bless her. I don't know what I would have done without that woman. We're still very good friends. but she advocated for me to get time off,
Mhm.
which was ended up being about 5 weeks or so. That was largely unpaid because again, I didn't even qualify for FMLA. So this is me feeling grateful that I actually did have some time, that I could actually get some time off. And this was like Thanksgiving. Amara was born 2 days before Thanksgiving, so this was like winter time, right? But then after coming back, I realized I also didn't know how to advocate for myself with regards to pumping because I was scared to ask. I was just, there was just a lot of insecurity, if you will,
Mhm.
that was there just because of so many things like, not having a husband, even though I was married, but feeling like I wish someone would speak up for me and because I really couldn't speak up for myself. But yeah, that article just basically details the importance of us as a country having a nationally mandated federal paid leave because the US is the only really one of 7 countries in the universe that does not have that. Also, it's a hot topic in my state, Pennsylvania, where we are advocating for paid parental leave. So that kind of is the summary of that article.
So tell me the interactions that you had with the residency program. On one hand, you said the residency director said that it wasn't a good decision, but on the other hand, you had some allies within the program that helped you out. So in general, was it uneven support depending on who you talked to within that program?
Yeah. So to clarify, it wasn't it was a residency coordinator. So she was like the program manager. She was a non-clinical member of the team. So she was responsible for like helping to make schedules and things like that. So she advocated for me to do that. Well, in terms of, I don't know that I had a lot of attendings that would, that supported that. I remember one of them, besides, it was a different attending who said, you showed up 4 months pregnant with a husband thousands of miles away. This is residency. What were you thinking? And then I had another attending tell me, well, I didn't breastfeed my children. I formula fed them. They turned out okay. This is a pediatrics residency program, right?
Sure.
But it wasn't, so I wouldn't say it was toxic, right? I wouldn't term it that way, but it was not, there was not extra effort made, or I would say barely any effort made to support me. The full circle moment though happened earlier this year, I believe in March, when I was invited to speak on a topic of breastfeeding as a health equity issue. And I went there and I found out there's a lactation pod where, residents who are nursing can go and have, dedicated space to pump. That definitely made me cry because I remember several days, well, pretty much all the time. It wasn't several days, it was every day where I would need to pump and I just couldn't find a room. And I would like find one, sit, and then my pager goes off.
Mhm.
So for me, it was definitely a full circle moment. But yes, I would say that was uneven support and maybe not toxic, but definitely not a lot of support.
And just to be clear, what is the current policy as it relates to parental leave?
So on a national level, we don't have a federally mandated policy with regards to parental leave in the United States, right? So it tends to be, so a lot of it's almost segmented. So some states like California is one of New Jersey, I believe New York is one of a few states in the US that actually have state mandated parental leave or
Mhm.
maternal leave. And then there are other companies like I live in Hershey, Pennsylvania. I know the Hershey Entertainment and Resorts has a really good package for parents. I believe the moms maternal leave, I believe they get up to 12 weeks of paid maternal leave after you've worked for at least a year. And I'm almost certain that dads get about the same thing. So so it becomes a thing of if you have a good job and you're lucky to live in a state that has that, then maybe you will get that. So it's not federally mandated at this time. But in the state of Pennsylvania, we're pushing for the state to pass that law of having paid parental leave.
So it sounds like it's entirely employer dependent or state dependent. And when it comes to medical institutions and residency programs, to your knowledge, what is the standard when it comes to paid parental leave?
That's a great question. I'm not sure that I know. I know again, just like we talked about it being state dependent or insurance dependent, it's again residency dependent. So it's up to the woman to advocate for herself and say, hey, I'm about to go on leave. So when I come back, or maybe the week before, can I do an elective where it's like a research elective and maybe I can be at home for a month? So it's been a lot of those types of things to the best of my knowledge. I don't know that there are a lot of now there are a few residency programs, and I think it's again dependent on who your residency director is. If you have a residency director that is supportive of it or who had her own personal experiences and really wants to pass that on, then it just becomes a matter of you're lucky you have a good residency director. So that to the best of my knowledge is what we currently have.
So it sounds like how easy or difficult it is on the mother who just gave birth is completely at the whim of the residency program itself.
Yes.
So, in terms of an ideal situation, let's say you were to replay the first few months of residency or your first year of residency while pregnant, in an ideal situation, what would you have liked to have seen?
Mm. I would definitely have liked to see a more supportive environment where I think colleagues that are understanding of of motherhood. Of course, I made the decision to be a mother, so I don't expect pity is not what I expect, right? But a support system where it's, it's and I had one or two of them, to be completely honest, who would say, "Hey, what can I help you with?" Right? Are you rounding up on patients? Maybe I can see the last one so you can go back to your daughter. So things like that. But also in terms of the transition back, I'd kind of alluded to having things like research electives. I think that's a good way to phase back in after coming back from leave. So I think ideally, in an ideal world, I would definitely want to see paid leave, right? And there are programs who've actually worked around this. I know a residency program in Colorado who's, I believe it's Colorado Children's, Dr.
Mhm.
Maya Bunick, who is actually the section and breastfeeding chair. They have a parental elective where you are, it's parenting, right? Maybe you're learning to be, you are a first time parent, and so that counts as an elective, right? So kind of incorporating it into the already existing curriculum, so it's not like you're having to pay back time, right? So having that kind of structure where you can have that be a parenting elective and maybe the next one be a research elective, um, after having had that time to bond with your child, because it's a life experience, right? And I'm so grateful for it because during that time I learned so much about myself. I learned about the strength that I had that I mean, up until then I looked at myself as weak in some sense. And so I found that I was able to do quite a few things and do them well,
Mhm.
right? But I think in an ideal situation, I would see a program that's supportive, but I think having a supportive program also has to do with education, right? And so for some people, they might just be nonchalant, not because they want to be mean, but just because they might not know what to do, right? And I think that's why it becomes important to even to have embedded in a curriculum, a residency curriculum, breastfeeding, right? We talk about, as physicians, we get almost no education on this, right? And I think regardless of what specialty you are, whether it's family medicine, pediatrics, anesthesiology, plastic surgery, whatever it is, one way or another, you're going to have to deal with it. Not
Mhm.
even if it's not you personally, even if it might be your patient, if you're a pediatrician, that's all you're dealing with in the first at least 3 months, right? Those types of questions around nutrition, or if you're a family doctor, but also if you're an ophthalmologist. I mean, I'll give an example. I went to my eye doctor several months ago, and I was getting ready to have drops in my eye, and the tech asked me, she said, are you pregnant or are you nursing? And I said, oh, I'm nursing. And she said, oh, then I can't put these drops in your eyes. And I said, why not? She said, oh, because I don't want to risk, getting it in the baby, in the milk for the baby. And so that was for me a time to educate. And thankfully I had someone who was willing to listen, and I spoke to the ophthalmologist, and then they created a policy around that. But I say that to say, including that in the curriculum is something that we need to be aware of, not just from a clinical side, but also from a community standpoint of being better physicians and being better advocates for our patients. So hopefully that kind of answers, kind of a complicated answer there, but hopefully that makes some sense.
One of the things that you said while you were telling your story is that you felt that you weren't able to advocate for yourself. Now, as you said, there's relatively uneven support in different residency programs when it comes to pregnant mothers or mother who just gave birth. Now, for women in those situations, what kind of tips can you share with them on how they can better advocate for themselves in a perhaps less than ideal supportive environment.
Yes, 100. And it's a lot of what I do now. So a big part of it is communication, right? And I think that's something I wish I did. You, I can't just expect people to save me. Sometimes people want to save you, but I don't know what to do, right? So I usually say communicate once you, depending on your level of comfort, if you're in a workplace where you feel like you can share as early as 4 or 5 months when you're pregnant, and then have a plan when you come back, like let your manager or HR know, well, this is how much I plan on taking off. When I come back, I plan on breastfeeding. I will need a lactation room to pump. I will need this amount of time during the day to do that. There are policies. The Pump Act actually stipulates that women have a right to a private nurse, a private place to pump that is not a bathroom, right? So making HR aware of these things, because for some employers they may not know, right? So communication is a big part of that, but also having a support system, like a tribe almost, and that may look like your spouse, but I think that's not enough. That a lot of times for a lot of women means a support group, right? There's a lot of information and there's a lot that you can learn from other women who've done it. And I will say that even for me, with that third time around, I had a colleague who went out at the same time as I did, and I learned a lot from her. She had a plan, she communicated it, and she had a plan when she came back, right? So I think, and then she had tips on how to go about it. And she was part of a support group, and she shared that she learned some of these things in her support group. So knowing about that, but also a population that I work with now is the women who qualify and or participate in the WIC program.
Mhm.
WIC stands for Women, Infant, and Children, the supplemental nutrition for women, infant, and children. And usually you have to be within a certain poverty level to get that. So these are women who are marginalized, who several times are women who do not know how to advocate for themselves. So teaching them about their rights, but also a lot of times, even when they know their rights, they're still scared because you think if I'm a single woman with 3 children and I have 2 jobs and one of them is I'm a cashier at the dollar store, I work at McDonald's, I may not know how to ask my manager for time, right? And so it may look you know, like simulating like time with her, or even several of these women have Medicaid, and
Mhm.
some of these MCOs work with community healthcare organizations that use community healthcare workers. So that means that some of the appointments, they have people who go with them. And so even training the trainer, training these THWs or community healthcare workers to know how to advocate for their patients. So it's a community effort, but those are definitely two of the most important tips I will say is communicate as early as you possibly can and
Mhm.
as early as you feel comfortable doing. Um, Join a support group. And if you're a physician, because I know that's a huge part of your audience, there is a Facebook group that's exclusive to female physicians or physicians who identify as female, called Dr. Milk.
Mhm.
Milk stands for Mothers Interested in Lactation Knowledge. And it's an exclusive group because studies have shown that when female physicians meet their breastfeeding goals, they're more likely to pass that on and be supportive of not just their colleagues, but also their patients. And so it's a group where all sorts of questions are asked. And I know that helped me in my journey, and I've paid it forward, right? And unfortunately, the reverse is the case. And I know I was on the receiving side of this, where an attending says, well, I didn't breastfeed my child and she turned out okay. So, I mean, suck it up and be okay.
We're talking to Amaka Nnamani. She's a pediatrician. Today's Kevin MD article is It's Time to Pass Federally Mandated Paid Parental Leave. Amaka, will end with some of your take home messages that you want to leave with the Kevin MD audience.
Absolutely. I would say number one, if you're a physician out there, number one, validate you. But number two, I think if you've had other interests that are not related directly to clinical medicine, it's okay to explore, right? Because you don't know what you'll find. If I didn't take this as crazy as it was when I did it, I would not have found this part of me. And I have never felt this liberated and truly happy being able to just nurture all the
Mhm.
different well, most of the different aspects of me, because I do have a lot of interests, right? So don't be too it's a scary journey, right? But don't be too scared to take that leap. Definitely have a support system. I found, because now I mean, I'm an accidental entrepreneur now, so I'm doing a lot of things like speaking and my books and working with organizations, and I wish that I had some business skills. That is one thing I wish I had, and I'm learning the hard way. But there are support groups and systems out there. Like a big one, I definitely want to shout her out, is Dr. Ona, right? She's a
Mhm.
female physician who's a pediatrician as well, but
Yeah.
she supports physicians in their journey to becoming entrepreneurs. So find groups like that, but definitely it's okay to explore other, because you are not just one thing. You don't have to be one thing. There can be different aspects of you, and you can find ways to intertwine them. And if you decide to stay in clinical medicine, it could probably make you all the better and happier, right? Because you're able to fulfill these other parts of you.
Well, thank you so much for sharing your story, time, and perspective. And thanks again for coming on the show.
It was an absolute pleasure. Thank you so much for having me, Kevin, and thanks for all you do for the physician community.